towards patient excellence, towards high standards of patient care, and it really reflects the true mission hospitality and clinical services. Okay, with that, today's event is also the same thing. IJN has always been in the forefront in being first. This technology, not just in Malaysia, but within the region and sometimes in the world. We always believe that being part of an institution that carries a very high standard, we have to have the latest technology so that we're able to serve the patients, especially Malaysians, better. Now, today is a proud moment because IJN and Dr. Saiful and Dr. Azlan have implanted the first dual-chamber leadless pacemaker, the AVIA DR, in Southeast Asia and almost within the APAC region. So this is extremely proud moment for us. And with that, I would like to get Dr. Saiful to explain a bit before Dr. Azlan.
Thank you very much. Assalamualaikum and a very good morning. Welcome to this press conference. Indeed, this is a very important day for us, whereby we're feeling very proud to be one of IJN team members. The best with today, you're seeing that Dr. Azlan will talk about later on how this implantation of the leadless pacemaker in a dual chamber situation would
devices, and implantable devices are called pacemakers. So IJN has been in service for more than 30 years. We have implanted more than 10,000 patients with pacemakers and other kinds of devices. And the previous devices for pacemakers consists of the device that you see on your left. So they have a battery, and the batteries are connected to the chambers of the heart on the upper part as well as on the lower part by wires, or what we term as leads. So before this, the advent of pacemakers, these are what we put in the patient. So for a patient that needs to go for a pacemaker, they have to go for surgery, where we cut a bit of their skin on the upper part near their shoulder, and we put in the wires, and we implant the wires in the left part of the heart, the upper chamber of the heart, the lower chamber of the heart, and we connect it to the battery. So when the heart rate is slow, the battery will send down electrical impulses to the heart, and the heart will beat. So this is what has been we have been doing for the last 20 plus years. The last 10 plus years, we have been implanting a device straight in the heart. So if you look at this device and you compare that to this device, you can see a few differences. Number one is that the devices are much smaller. So if you look at the device size now and the device size before, you can see size-wise they are much smaller, and they do not have wires at all. So when they do not have wires, issues related to the wires are not going to be there anymore. And number three is that we can actually, you see this tube here, so we put in the battery direct into the heart, and we take the tube out. So we do not have to cut the patient. So this is what we have been moving on for the last 10 years in some selected patients, not all patients. And this was, the initial research for this was actually done in IJN before it was used all over the world. We did this about 12 years ago, and ever since that we have been extremely excited. But the issue with this device is that at that point in time, up to recently, the device can only be implanted in the lower chamber of the heart. So now, if you look at this device, this was what was available about 10 years ago in Malaysia. We have implanted nearly 900 of these devices in Malaysians and in patients who really needed them. But what we have now is a device that we can input or plant in the upper part of the heart. And this is the one that we are excited about, because if we are going to implant this device on the upper part of the heart, this is going to be able for us to mimic the kind of device or the kind of configuration that we have in the picture on the left. So, if with this new device that we can implant on the upper part of the heart, if there is a need be, we can put devices on the upper part of the heart as well as the lower part of the heart. We do not have any more wires. We do not have to cut the patient. So the excitement for us is the privilege of implanting this dual chamber pacemaker in the first that in Southeast Asia, and probably the second or third in the whole of Asia Pacific, and that is a privilege for us. And we are excited because from the doctor's point of view, we can translate this benefit to the patient. We do not have to be cutting the patient up nor do any surgery, because we can put the battery direct into the heart. The patient will not have any wires inside the heart. So therefore, problems associated with wires are not going to be present anymore. And this includes infection. This includes the vein being blocked because the wires is there for a long time. This includes things like the wire getting fractured or the wire getting bent. So we do not have to deal with that anymore because there's no more wire. There's also a lower risk of infection. Patients with a standard pacemaker, patient with a wired pacemaker, has a risk of infection of approximately about 5 to 10%. If you put a pacemaker that has no wires, that risk comes down to about less than 1%. So the chances of infection is very much reduced. If we have this pacemaker without wires or leadless pacemaker, we can make the patient move earlier. They do not have to have so much pain because we are not cutting them up. They are not exposed to the risk of surgery such as an infection because we do not cut them up. And once they have that, their status of mind and their functional ability will be much better as compared to implanting a standard pacemaker. This pacemaker is suitable in a hospital setting. Most of our patients with infection, we can implant these batteries and we do not worry much about infection that has been existing with that patient because the chances of infection, as I've said earlier, is much lower. And the benefit of patients who are on blood thinner is very good. For example, if the patient is on surgery that requires the patient to be on lifelong blood thinner, now they do not need to stop the blood thinner to have the procedures done. They do not need to be associated with risk with stopping the blood thinners because we are not going to stop the blood thinners when we do the procedure. And more importantly, in our context in Malaysia, is that in patients who are on dialysis, who has renal failure, this is an extremely important alternative because we do not have to put in wires through the vein. As you know, if patients have renal failure and they have dialysis, the nephrologists or the kidney doctors will use the excess from the vein to make the patient go on dialysis. If we put in a pacemaker that is standard conventional pacemaker in this group of patients, they are exposed to a lot of problems. Number one is that they are exposed to a higher risk of infection. Number two is when we put in the pacemaker with wires inside the veins cannot be used for dialysis anymore. So that is going to be a big problem in patients with kidney disease because when they cannot go for dialysis, then they are at a very high risk of death. So for patients with chronic kidney disease who are on hemodialysis, Malaysia is one of the countries in the world which has one of the highest number of patients with kidney disease. This is a good option to have for this kind of problem. So for that, we are extremely excited to be able to have this pacemaker which basically completes the whole spectrum of possibilities of patient that needs pacemaker without any leads in the body. Thank you very much.
Thank you to our distinguished panel for the insightful presentation. We'll now open the floor to questions from the members of the media.
Hello, good morning. Good evening from us today. So I have about two questions. What are the stated, this is very suitable for those with blood thinners and kidney diseases, but are there any other expected long-term outcomes for patients with this device? Any other benefits that they can gain with long-term usage?
The benefits with long-term usage is that, number one, we don't have to deal with complications related to the leads, nor related to the surgery. Because if you don't have any surgery, all surgery-related issues are not available. Number two is that long-term, if this pacemaker needs to be removed, because the battery has already exhausted its supply and we need to replace a new supply, the process of removal is much easier because we only need to be concerned ourselves with removal of the battery without needing to remove the lid. So for a doctor who deals with this, that is much a better option and safer option, because the more you remove with the lid, the higher the chances of complications during the procedure. As far as the outcome for clinical outcome is concerned, they are actually similar.
Second question, there are several benefits to this device, but has there been any limitations or issues that have been discovered during the testing or implantation process?
So we have experienced this for about 12, 13 years. And we can say with some conviction that the chances of complication with this pacemaker is actually much lower than that with the leadless pacemaker, either in the short term, in the intermediate term, as well as in the long term. The chances of complication and acute complication is less than 1%. The chances of complications on the long term is usually between about 1 to 2%. So that number is actually comparable and in some accounts much lower than the standard conventional pacemaker.
Okay, and as stated, this is designed for patients with slow or abnormal heart systems. Will it also benefit other kinds of patients, or is there a certain procedure that patients will undergo to determine whether this will benefit them?
The requirements will be two. One is the documentation that the heart rate is indeed slow, and usually that goes by documentation devices such as an ECG or a recorder. And the second is symptoms, when they start to have problems with a slow heart rate. As for other kind of rhythm problems, that will be other kinds of devices, but not pacemaker. Pacemaker is solely for slow heart rate patients.
One more question. Are there any plans to collaborate with other hospitals in Malaysia and Southeast Asia to expand on access to this technology?
Yeah, so as a premier hospital, tertiary care in this center, what we does is that we train other doctors from other hospitals, not only from Malaysia, but also from Indonesia, surrounding areas, who actually comes to our institution to be exposed and to be trained with this technology, so that when they go back to their hospital, they can carry the same procedures as what they are being trained to do here.
Okay, last question from me. What are the next steps of IJN in terms of research, training, and further adaptation of leadless pacemaker technology? Is there more plans for this or any other projects in work?
Yeah, there are some projects in work. There are certain other batteries that we are working with the company to come up with certain specific subtypes of slow heart rate, but those are in the works, and probably you should see some development on that in a few years from now.
Dr. Hassan.
Yes.
So, this launch impose a pacemaker for, let's say, the non-government patient. How much will it cost for them to implant this thing?
So cost is something fairly subjective at this point in time. We are still on discussions to make special arrangements for the cost to be different in the structure-wise as for the government patient as compared for the non-government patients.
May I add to that? Yeah, usually when we start something new, the cost will be a little bit more expensive because it's a new technology. Same thing like your iPhone lah.
So we call by insurance.
No, it should
Well, we will see whether that will come or not. I can take some instance for likewise when we did the valve exchange. When we started off, it was very expensive. When we have more companies coming in, the price starts to come down, and then only the insurance might take it. So we can go from there.
I think in general, IJN's cost is much lower than most private hospitals. Okay, I think that's quite well known. And what happens is that we always utilize revenue from private patients to cross-subsidize our government patients. So that helps. Yeah.
Okay, thank you.
So, since cost is still very subjective then, what advice would you give patients then regarding this technology on how giving them awareness and regarding the implementation process? What do you say to patients then if they are interested in this technology?
Well, normally we will, once the procedure is established, we will usually give it as an option to the patient. They can still have the old technology, which is the one with the leads, the pacemaker with the leads. And for example, this is the pacemaker with the leads, where you have this under the skin and this inside the heart. Whereby the new one, like what Dr. Azlan pointed out, this is directly inside the chamber of the heart without the need for the leads. So that option will always be for the patient. Of course, I would see that this is much cheaper at the moment, and this is probably more expensive.
Doktor nak tanya, bila saya daripada Suara TV, sering.com. So ini adalah IJN yang pertama gunakan. So di Malaysia IJN dulu. So mungkin adakah ini is a macam produk di sole distributor? Adakah hanya sekadar IJN saja boleh gunakan? Mungkin ada hospital lain boleh gunakan sistem ini atau tidak macam?
Okay, saya akan jawab soalan tu. So sebelum mana-mana syarikat, especially multinational, untuk dia nak minta hospital untuk menguji atau menggunakan produk yang baru, dia pertama sekali dia akan kenal pasti kemampuan hospital dan kemampuan doktor dulu. Itu yang paling penting sekali, sebab kalau kemampuan tu tidak setaraf yang mereka minta, dan nanti kalau ada kegagalan, menunjukkan tu device tu yang gagal lah. So pertama sekali dia kena identify sama ada kepakaran yang ada di hospital tersebut cukup setaraf dengan standard dunia, dan juga fasiliti yang ada di hospital tu. So tu yang paling penting sekali. Jadi dalam kes ni dan kes-kes lain di mana kita bukan yang pertama sekali, bukan sebab perniagaan, it's not a business reason, tapi it's actually a clinical excellence reason sebab dia. Jadi kemampuan Dato' Azlan dengan tim dia yang mampu untuk mengendalikan mesin ni, pacemaker baru ni, yang paling penting sekali. Kemudian keperluan facilities yang ada dalam IJN, sebagai contoh imaging untuk melihat struktur dalam jantung tu mestilah yang terkini dan yang paling sophisticated, so that nampak dengan jelas. Jadi kalau hospital yang tak mempunyai kepakaran dan juga fasiliti itu, susahlah untuk syarikat tu menyuruh atau meminta, walaupun dia bayar pun syarikat tu tak akan buat. Dia akan pilih hospital yang mampu. So jadi dari segi IJN bukan sebab bisnes ataupun sebab perniagaan ataupun wang, tapi sebab kepakaran yang ada. Itu yang
mungkin memberi kepakaran yang ada itu berkongsi dengan hospital lain untuk collaborate, supaya apabila mereka ada patient yang begitu, you can work together with them and give a service for this.
I think memang kita dah ada networking tu, Dato' Azlan dan tim dah memang ada networking. Kadang-kadang ada pesakit yang datang daripada hospital kerajaan ataupun hospital swasta ataupun daripada negara-negara jiran, datang sini. So memang I think Dato' Azlan tim selalu mengadakan khusus, sebab IJN bukannya hospital yang nak menerima, tapi kita juga satu hospital yang nak mengajar. Pasal tugas kita, sebab tu je institute, Jantung Negara Institute tu ialah untuk mengajar. Kita mesti mengajar, itu salah satu daripada tugas kita, is to ajar, to teach, to train and to help others. Itulah fungsi kita.
Ya, jadi dalam kes-kes yang tertentu ada pesakit kanak-kanak juga boleh mendapat faedah daripada rawatan ini, dan IJN ada ini dalam pesakit daripada populasi kanak-kanak. Secara keseluruhan kita sudah mencapai 18 pesakit untuk alat yang ini, tapi untuk alat pacemaker tanpa wire, IJN ada pengalaman selama lebih daripada 10 tahun dan menghampiri 900 pesakit yang memerlukan yang memakai alat pacemaker tanpa wire atau wireless pacemaker. Prosedur untuk implant bergantung, selalunya dalam pengalaman kita boleh antara 20 minit hingga kepada dalam 1 jam.
Untuk makluman, yang Dr. Azan cakap yang dah 9 tahun tu adalah leadless pacemaker dalam ventricle, dalam chamber yang besar tu, ventricle, chamber bawah. Yang baru dibuat ni yang melibatkan chamber bawah dan chamber atas sekali. Ini adalah perkembangan barulah daripada yang dulu.
Ini operasi minimally invasive.
Yes.
It's catheter based.
Dia catheter based. Catheter based maknanya kita masukkan tiub, kita keluar masukkan alat, kita cabut tiub
Masa tu tahun
melalui kawasan groin.
Ada surgery. Tak pakai pisau lah basically untuk potong. So ni pakai jarum saja.
Kita akan memasukkan alat ni melalui femoral vein, vena femoral di bahagian kaki, dibesarkan sedikit, masukkan ni, kemudian bila keluar kita jahit aja lubang tu, dia tak perlu nak cut, tak perlu potong.
Macam ni umbrella,
Correct.
close the hole.
Correct.
Thank you everyone for the engaging questions. We'll now proceed to the photo session with all our
Thank you.
photographers will now come together.
Any other questions? Question?
Ada? Boleh dapat data tentang Malaysia, kat Malaysia, berapa patus yang sakit jantung?
Kalau dah ni